Welcome back to Great Day Washington. There's a new study out showing that eating disorders are on the rise during COVID-19. To better understand why this is happening, I caught up with someone who's directly involved with the study, Dr. Bryn Austin, the director of the Strategic Training Initiative for the Prevention of Eating Disorders at the Harvard T.H. Chan School of Public Health, to ask her about it. Dr. Austin, welcome to Great Day Washington. It's great to have you here.
Thank you.
It is incredible to think of the study that came out and saying that eating disorders have been on the rise through COVID-19. Why do you think that is?
We know that these are tough times. Our healthcare system is overwhelmed. We know too many people are getting shut out of care because of the color of their skin or their zip code. These inadequacies and inequities in our healthcare system have only compounded the risk for people who are struggling with an eating disorder. I would say, in particular, the barriers to care now we know are much tougher. Intense isolation with the shelter-in-place rules, the feeling of the world out of control. These are creating conditions of a real mental health crisis with depression and anxiety. And it's the same with eating disorders worsening because of that. And one note I wanted to make is mental health experts are very concerned now with the pandemic that it might increase suicide rates. Well, already before the pandemic, people with eating disorders had more than 20 times the risk of suicide compared to healthy peers. And that's the frightening reality that we're facing now.
One thing that stood out to me in the study was where it said 30 million Americans, or nearly 30 million Americans, would have an eating disorder in their lifetime. What were some of the key takeaways that you saw from the study?
Yeah, key takeaways. Like you said, eating disorders are so much more common. They are deadly, and they are expensive to our economy. Many people don't realize that eating disorders affect people of all race, ethnicity groups, all ages, all genders, all sexual orientations. Everyone can be affected by an eating disorder. Nearly 30 million Americans means almost 10% of our population will have an eating disorder in their lifetime. And eating disorders are among the most deadly of any mental health condition, killing over 10,000 Americans every year, or one person every 52 minutes. I mean, think about that. Every 52 minutes, somebody's sister or brother, somebody's child or parent needlessly dies from this preventable and treatable condition. Our report showed how expensive eating disorders are every year, costing our economy almost $65 billion. Employers and policymakers really should take note. 3/4 of that amount, or nearly $50 billion per year, is in productivity losses. What that means is absenteeism or impaired work because of being ill or taking care of an ill family member, or premature death. These are the kinds of impacts on our productivity when eating disorders affect people in the prime of their working life for the most part, and that it really intense the burden on our economy.
You know, during this conversation, you've been referencing many things that are going on right now that are very heavy, that need immediate attention. Why should eating disorders also be part of that group that we're really focused on right now?
Well, we know that the pandemic and the social unrest and the movement, really the Black Lives Matter movement, is bringing to the fore how many inequities we have in our healthcare system. They are impacting people across all walks of life. When we have a healthcare system that is not able to deliver care to people because of their zip code, because of the color of their skin, or because in some other way they're shut out, this is a real loss for us as a society that we need to address, and eating disorders are a piece of that. We know that the vast majority of people with eating disorders don't receive treatment. Now in a pandemic, when hospitals are overflowing, when emergency rooms are having to stay focused on the COVID epidemic, what that means is people with continuing or chronic conditions like an eating disorder are getting shut out even more by all of these forces.
Dr. Austin, I know this has also been very heavy. Is there one really quickly way that we can help lift up people during this time and mitigate these eating disorders?
What's so important is that we start routine screening. We need to be screening in our schools, in our doctor's offices, clinics, workplaces, all these places where we could be finding people early. If we can find people with the symptoms early and get them on a healthier path, then that's going to help bring down the costs of eating disorders and reduce the suffering. We know that the best way to bring down the cost is going to be through finding people early and getting them into care. And that's going to help families and individuals, employers, and society. And most importantly, it'll save lives.
Right, to recognize it in order to help treat it and do something about it. Dr. Austin, thank you so much for being here and enlightening us on this.
Thank you.
So we want to remind you, if you or a loved one needs some help, we have some hotlines on your screen for you right now. The National Suicide Prevention Hotline is open 24/7. It is free and confidential. The number to call is 1-800-273-8255. Then there is also the National Eating Disorders Association helpline. Their number is 800-931-2237.